Hi guys, welcome back to the Stretching Samurai. My name is Patrick Ravel. Today we're going to talk about a subject that happened to me 2 days ago, 48 hours ago. I injured myself. I sprained my ankle as I was going up a hill. I left my car at work and I had a portable scooter which I use because it saves me a lot of parking meter fees. And as I was pushing down, giving myself a push to go up a hill with it, my ankle smashed into the screw and the bolt that was holding the wheel in the back. And as it smashed in, my foot inverted or everted depending on how you're looking at it, but me it's an everted foot, and sprained the inside of my foot. So I had to act very fast because when you look at an injury, there's 3 stages. You have a mild irritation, followed by inflammation, followed by maybe torn or partially ruptured ligaments. In my case, I can stand on it, so it's not a problem. It's not a fracture either, or else I would have been in a lot more pain, sharp stabbing pain. But I did feel a lot of swelling, and if you see the pictures that will follow through this little intro, you'll see how bad it was. It was open, it was fully swelled up, it was 3 times the size. So what do you do now? So just follow my 1, 2, 3 steps. Okay guys, so step 1, we need to ice the injury, okay? So if you don't have ice at home, you don't have an ice cube tray, here it is. You know what this is? This is basically 2 baggies, one on top of each other, and inside is filled up with dishwashing liquid. I have this in my fridge all the time, and if you want to know how to make it just perfectly, go on my video. I'm going to post a link on how to make a cryo pack like this. So step 1 is always to ice first. A lot of people believe that rest, ice, compression, elevation is the key. Of course, it is the first step of any injury. So in this case right now, we're going to look at my foot. This is 48 hours later. As you can see, from the first picture that you've seen before, most of the swelling has gone down. This has scarred, and at the same time, there's still a little bit of edema here. There's still a little bit of blood pooling here. So what you're going to do is you're going to take the cryo pack and just put it there, right on the skin. Now, a lot of people say you need to put maybe a rag or something to prevent skin necrosis because it's too cold. Sometimes what I like to do is I put a few baggies, one on top of each other, until basically it's comfortable enough for my ankle. So what you need to do is put this for 10 to 15 minutes until basically the ankle goes numb. And this is for the first step you need to do. So all you need is really a few baggies and some dishwashing liquid. And don't forget, if you want to see how to do it, just click on the link. That is step 1. Okay, so there you go. Boom, I iced the sprain. Okay, let's move on. Step 2, what you need to do is go see an acupuncturist or posturologist, which will have a Premium 32 or the next laser, which is accelerated tissue regeneration. On a laser like this, you got analgesic, regeneration, relax, and maybe a mix of everything. So I put it to A, B, C, D, E, F, G, which is a little bit of everything because that's what my ankle needed to regenerate a little faster. I'll put it on. There we go. And then I hold a point for about 30 seconds to a minute. I can shoot basically the laser on the wound itself. And what does this do? This is an instrument that basically accelerates tissue regeneration. So there's a lot of different devices that repeats this kind of frequencies. The Nogier frequencies can be seen with impulsion machines, lasers, and different apparels just like this one. So I'd go see somebody that has that, and I'd shoot that ankle about 2 to 3 minutes. And of course, I'm going to just stop it right now. Okay. It's got to be on all frequencies so you can take away the pain, bring down swelling, and increase tissue regeneration. That would be my second step that I do. So you can find somebody, a health practitioner that has one of these, and it really speeds up the recovery. This is 48 hours later. So just remember, when you looked at the first picture, it was very swelled up, and now it's almost gone. You still got a little bit of edema here, but we'll take that down. Okay? So guys, I hope you liked this little video. I hope it's helpful to do first aid and treatment immediately after an ankle sprain. If you've got any questions, please feel free to inbox me. And if there's a topic I haven't touched yet, please let me know. I'll make the video for you. This is the Stretching Samurai saying good night. Ciao.